I am a general internist. I'm also board certified in obesity medicine. I work as an associate professor at NYU Langone Health, and I also see patients and do research at the Manhattan Veterans Affairs at the VA. Oh yeah, so this was a topic that's near and dear to my heart, addressing health equity and health disparities. We defined this came out of an ACP seminar and ACP. Actually, let me think about this. Sorry. So this session came out of an ACP summit to really how is the ACP and all the subspecialty practices going to address health disparities and health equity with obesity care. And so at the first intro, we discussed kind of what happened at that session. And then I introduced the concept of disparities in obesity care, health disparities around obesity. And then we also talked about different strategies to address health disparities and health equity in obesity, and really touched on kind of 4 or 5 major areas. One of them being to really address obesity stigma. So obesity is a stigmatized condition. Over 40% of people with class 2, class 3 obesity say that they've experienced weight discrimination. It's pervasive in our media, in our society, even the way we portray people with obesity. And patients really say that they have experienced obesity-related discrimination and bias, even in healthcare settings. So we talk about how we can provide more compassionate care, not blame the patient, recognize that obesity is a disease, that it is, as a chronic disease, it's an interplay between our genes and our environment, and kind of personal choices, while can be important, play a very small role. Things like our food environment, stress levels, our physical activity opportunities, medications we give our patients that can cause weight gain. And so when someone comes into the office and they feel blamed, rather than having it be a partnership of how are we going to address this with all the new treatments that we have. So that was one, addressing obesity stigma. The other thing would be advocacy. You know, as physicians, we have a lot of opportunities to really advocate for our patients. So we can advocate for policies such as Medicaid expansion of obesity care, such as Medicare expansion as well. There's federal policies right now trying with the Treat and Reduce Obesity Act. We can locally make sure that our residents and our medical students get adequate training to be able to compassionately and proficiently address obesity. And then we can make sure that we provide interdisciplinary care, that we work with each other, that we engage that not only our other healthcare team members, but also the community, and really understand. And then there's research. I do a lot of research, so that's my area. And so we not only have to understand what are the obesity disparities, what are the opportunities where we can intervene, but then we have to actually test interventions. And I'm very interested in how do we treat obesity, especially in primary care settings. And so we need more research to understand, even though we have all these new treatments, we don't know yet the best way to implement them.